Yeah, when the live hits the stream.
Okay.
It'll be.
Oh, there it is. Oh.
Actually, I just gotta do one thing. I'm trying to do it on our Instagram. I want to see if it'll work.
Okay.
So bear with me. Let me see.
Checking.
Oh man, it doesn't want to work. I see people trickling in. I see 2 folks on my Facebook. Hi y'all. We can wait for a few more people maybe. So this is going to be a seminar about Cuba's response to COVID-19. And we are just going to wait for a few more folks and then get started in a minute. Five people. All right. I think we got 5 folks watching. I'm sure more will join. So should we get going?
Yeah.
Cool. So greetings, everybody. My name is Onya Sanu. I'm an organizer with All African Peoples Revolutionary Party in Mexico, here on occupied Cuba territory. Also a member of the Venceremos Brigade.
Hello, everybody. Marahapa. My name is Sheldon Tenorio. I'm here as an organizer with Public Action Alliance, a part of the New Mexico Venceremos Brigade Committee.
Hello, I'm Roberto Roybal. I'm born and raised in Santa Fe, living here in Burque, Antigua land now. I've been with the brigade for many, many years, since about 1979, 78, the New Mexico Venceremos Brigade. And I'm currently an organizer and worker at Southwest Organizing Project. Welcome.
So today, we let y'all know a couple of months ago that due to the pandemic, unfortunately, the 51st Brigade, the 51st Venceremos Brigade has been indefinitely postponed because the United States is a den of disease and does not have the pandemic under control. And so as a result, we want to continue organizing Cuba solidarity work, but our focus has shifted a little bit. So we have these meetings every single month on the third, is it the third Wednesday or the last Wednesday? On the last Wednesday of the month. And it's the last Wednesday, on the last Wednesday of the month. And so we decided that because we wanted to keep having these meetings, instead of like actively recruiting for the next brigade, because we don't know when it's going to happen, we are instead going to focus on doing political education about Cuba. Because as you probably know, if you're watching this, if you live in the United States, we hear like nothing but constant lies about Cuba and the Cuban Revolution. And so we thought this would be a really good opportunity to every single month focus on a different subject and tell the truth about what Cuba is and tell the truth about the Cuban Revolution. So this week, or this meeting, our topic is going to be Cuba's global response to COVID-19. And me and Sheldon are put together a presentation that we're going to walk through with you. So let me share my screen.
Awesome. Thank you, Oni.
Cool. Can y'all see that? Is it full screen?
Yes.
Dope. So yeah, this is a presentation about Cuba's response to COVID-19. Let's get going.
Awesome. Thank you for that, Oni, again. My name is Sheldon Tenorio, calling in from Tiwa territory. Before we get started and actually get into Cuba's contributions to the globe against the fight against COVID-19, we've got to be able to understand how that's even possible and how that came to be. and the attributions being to the history of the Cuban medical solidarity, which Oni will also elaborate on after this slide. The establishment of the Latin American School of Medicine, or ELAM for short. It was established in 1999, and this was a direct response to a couple different hurricanes that devastated the islands, devastated the area, the Caribbean area, the hurricanes George and Mitch in 1998. And since then, the ELAM and the Cuban government were able to offer over 500 full scholarships to the medical program there. And they started out in 4 different countries. And again, keep in mind that these 4 countries that they offered these scholarships to were the countries that were devastated the most by these hurricanes. So that's the Dominican Republic, Haiti, Honduras, and Nicaragua. And ELAM was established in 1999.
So since ELAM was established, Cuban, thousands of doctors have been trained around the world by Cuba, both inside and outside of Cuba. ELAM doesn't just train Cuban doctors within Cuban borders. ELAM also trains doctors in countries all over the world, so that it's not just about Cuba swooping in and saving the day. They give resources to other, particularly global South countries, to build their own medical infrastructure by training doctors in other places. So some achievements of Cuban trained doctors and Cuban doctors themselves are helping to eradicate malaria in Tanzania. Malaria is a leading cause of death all over the African continent. If you go to Africa, when I went to Ghana, I had to take malaria pills on a constant basis, because if you get it and you get really sick, because of colonization, because of imperialism, there isn't going to be medical infrastructure to save you. It's going to be very bad. And that's been the case for a very, very long time. And so the Tanzanian government, which has had a long principled relationship with Cuba since the Cuban Revolution, reached out to Cuba for help with this. Cuba sent doctors and scientists that helped Tanzania eradicate malaria within its borders. And that is an extremely huge thing, considering how dangerous malaria has been on the African continent. Also, as Sheldon mentioned, after Hurricane Mitch that devastated the Caribbean coast of Central America, the Atlantic coast of Central America, Cuba sent doctors to Honduras. My family is actually from Honduras. I think you need to know about Honduras. It's basically a fucking client state of the United States. It's a neo-colony. Its government has always been a US puppet, with a few notable exceptions that were overthrown very quickly. But for that reason, Honduras is basically it's an export colony. It just exports its resources and allows the US government and the US military to do whatever within its borders. And that means Honduras's social service infrastructure, its healthcare infrastructure is extremely weak, because no resources were dedicated to building it up. And so when Hurricane Mitch came and destroyed many, many communities, including Garifuna communities where my family lives, there were no resources available in Honduras to help rebuild and to help folks in the immediate aftermath with their medical concerns. And so Cuban doctors quite literally saved people's lives in Honduras. People were going to be left on their own because the Honduran government did not have the capacity to help them, and Cuba saved the day. And then also, throughout Central and South America, in a lot of places that have in a very similar situation to Honduras, they're neo-colonies or client states that are not allowed to build up their own social service infrastructure. The Cuban doctors are very often the only regular healthcare that exists. And this is all over Central and South America. So one specific example is Brazil. In Brazil, there are millions of people that live in extremely rural areas that are very underdeveloped, that do not have their own healthcare infrastructure. And so in many cases, clinics set up by Cuban doctors are the only medical facilities available in a given area for miles and miles and miles for hundreds of people, thousands of people. So when Jair Bolsonaro, who's literally a fascist, when Jair Bolsonaro came to power last year, he threw out the Cuban doctors from Brazil. He said that y'all are trying to convert people to communism and we don't need you, and get the hell out of here. Then early this year, COVID-19 hit. Brazil gets wrecked because he threw out those doctors and there was nothing else available to replace them. And so Jair Bolsonaro, despite being a fascist, despite accusing Cuban doctors of trying to convert people to communism, he begged for them to come back. This fascist, this like anti-socialist, this like ideologue who threw them out like months before was like, please come back, because he knew that the doctors couldn't even get to where these folks were that were sick. They had been previously helped by Cuban doctors. The Cuban doctors were effective at providing healthcare for these populations, and he knew that shit when he threw them out. And when the pandemic hit, he was like, oh my God, it's gonna be really bad. We need them again. So he asked them to come back, and of course they did. And then also the US, like the Cuban doctors have traveled all around the world, and the US is no exception when the Cuban doctors have been allowed in, right? Because the US government treats Cuba as like an enemy, because Cuba committed the crime of winning, like fighting a revolution, winning and building socialism. So the United States could not have that. The United States wanted to exploit Cuba, and so Cuba freed itself, and the United States was like, we hate you now. But there's been a couple of times throughout history where Cuban doctors have been allowed into the United States. In two cases in the 60s and 70s, there were Cuban doctors in the inner cities of Harlem and Chicago that set up clinics and medical research programs with universities in the area and used those to provide healthcare for poor and working class African people in those communities. So Cuban doctors have helped my people, not just in Honduras, not just in the Caribbean, but also within the borders of the United States. And when Hurricane Katrina hit in the early 2000s under the Bush administration, Cuba was ready to respond. They organized 1,700 doctors, I believe 84 field hospitals, and several tons, like literally tons of medical equipment that they were ready to send to New Orleans to help the people that were impacted by Hurricane Katrina. The US government under George Bush Jr. turned it down. They refused. And as we all, I'm sure that we all remember, I remember watching this on TV, but the people in New Orleans were completely abandoned because they were majority African. The US government turned down the help from Cuba and then did not show up for those people. They basically said, we're gonna fuck this free help, and also we're going to let you die. And that's precisely what they did. And of course, 1,700 people went on to die in the aftermath of Hurricane Katrina. Next slide.
Awesome, thank you, Oni. Part of the medical innovations from the Cuban doctors also have been advances in vaccines and treatments in lung cancer, eradicating mother-to-child HIV transmission, even as far as creating vaccinations and treatments for diabetes. So the first one we'll go through is lung cancer. And one of the vaccines and the treatments there is a Combavax. And a lot of the research, a lot of those trials started in around the mid 1990s. And along those trials, patients in Cuba who were given this vaccine, who given that treatment, the numbers show that they were able to live 4 to 5 months longer than those that were not given the vaccine, not given this treatment. And it's been free in Cuba since 2011 and has since been given to over 5,000 patients worldwide. And again, we'll get into this later as well, and Oni will be able to cover it too, about why these vaccines and these treatments aren't available here in quote unquote US is because of the economic sanctions and the embargo on Cuba placed on them by the US, quote unquote US. But we'll get into that later. Yeah, and again, because of the economic blockades and the travel ban on Cuba, there's been a couple cases where folks from quote unquote US have gone to Cuba to get the treatment, have gone to Cuba to get the vaccines. And again, just to, thinking about taking a risk to be able to know that another country has that vaccine and another place has that vaccine, and to be able to see those numbers and those trials actually like be able to have something done about that cancer, about lung cancer. The same thing with eradicating the mother-to-child HIV transmission. Cuba was one of the first countries to do that, and that's huge. That's major. And again, creating those vaccines and creating that treatment, it was available there in Cuba. For Cubans and other folks around the country besides the US because of the economic blockades and the US sanctions. The same thing with the vaccines and the treatments for diabetes. Again, being able to be there too as well, we saw firsthand. We were able to go to the biotech facility and listen in from medical researchers and doctors themselves, and told us about the vaccines and told us about those treatments, and being able to see that they were able to stop having to have amputations, and given those vaccines, and even seeing regrowth in specific areas in the body where diabetes was there, and being able to just take that vaccine and get that treatment and not have to get amputations like that. That to me was super huge and even all of the medical advances and innovations is just super hopeful. And it's just amazing to see how much Cuba puts the people first, puts humanity before everything, and thinking about their people first, before thinking about trying to make a profit off of some sort of vaccine or some sort of treatment. One of the things that was really cool, I think, was the fact that there was a nation, an indigenous nation, the Mohawks, who went to Cuba after they won their revolution, and were able to acknowledge the Cuban government, able to acknowledge Fidel Castro and their fight, as well as them being able to build and be in collaboration with Cuba around learning about the vaccines and learning about these treatments. There was a Mohawk delegation that traveled again to Cuba in 2016 to learn about those vaccines and treatments for diabetes as well. And I thought that was cool. I thought that was huge to see that nation, that nation to nation building, the solidarity and the collaboration between nations and peoples. And that's one of the reasons too that the lung cancer vaccine was able to be researched and developed as well. Was there was a time that one of the first joint collaborations between a cancer treatment facility in New York, as well as the facility in Havana, Cuba, for the development and the treatments and the vaccines of Clamavax and Vaxera. Vaxera is the next one that's being worked on and tested as well, and that's literally in collaboration with the cancer research program in New York City. So, yeah. Oh, you're muted.
I know, sorry. Okay, so we gave y'all a little bit of context about, Cuba's history of medical solidarity, what Cuba's medical innovations look like, and now I want to get into a little bit about Cuba's response to to COVID-19. And we want to start off by first describing the US response, so you can get an idea of like the worst possible way to handle a pandemic. And then we're going to contrast it with a good way to handle a pandemic. So let's get into it. First and foremost, the US has now become the global epicenter of the COVID-19 pandemic. It has the highest number of cases per capita in the world. It has crossed over 100,000 deaths. It is basically a shit show. And if you live in the United States, this is not a surprise to you. So why has this happened? How is it that the US became the global epicenter? Well, a couple of factors. First and foremost, no one has any idea how many people actually have COVID-19 in the United States. No one has any motherfucking idea. Like there's the count, right? Based on the people that have been tested, except mass testing has never been available inside of the United States. And mass testing was one of the key factors that led to other countries like Cuba, like Venezuela, like Vietnam, and South Korea, getting the situation under control. So mass testing has never been a thing in the United States. In fact, where we live in occupied Tiwa territory, also known as Albuquerque, testing is only available if you have symptoms. But we've known since March that asymptomatic spread, meaning people with no symptoms can have COVID-19 and spread COVID-19. So what kind of sense does it make to say you can only get a test if you have no symptoms? From jump, that means there's probably like thousands of people walking around that have no symptoms, that have no idea they have this virus, and that are giving it to other people. So that's the case in Tiwa territory, and that's the case in many other places. Tests are extremely hard to get. And even if you have symptoms and you are able to access a test, in a lot of cases, the wait is extremely long. For example, here in Tiwa territory, once again, they were offering mass testing in like a public park that's known as Balloon Fiesta Park, because they do like hot air balloon shit there. And so they offer public testing to folks with symptoms at Balloon Fiesta Park. And let me tell you, the testing was available for a very brief window from 7 a.m. to 11 a.m. And in order to actually get a spot in the line, you had to get there by like 4 in the morning. And then you had to wait in line for several hours to get this test. And there was a limited number of tests available per day. And this is not something that's unique to New Mexico. It's not because like New Mexico is like super fucked up. Like New Mexico is actually one of the states that's handling this like better than the other ones. But the reality situation is that tests are not widely available and access to them is pretty tightly restricted. In New Mexico, they're free, but in some states, you have to pay. You have to either have health insurance or come out of pocket, and the tests are hundreds of dollars. So even if tests are available, in a lot of cases, you can't even get one. And if you don't have symptoms, well, good luck to you. And so put all that together, and that means that there are many, many, many people that have this virus that truly have no idea they have it, and there's no way for them to find out they have it, even if they're sick in a lot of cases. The other thing that never happened in the United States is contact tracing. Contact tracing is when someone gets COVID-19 and you find out who they've been in contact with, and you reach out to those people and find out who they've been in contact with, and you test them, and you figure out, like, by doing that, like where this virus is going, and you try to stop its trajectory, right? That has never happened in the United States. It doesn't really exist in New Mexico. Right now, like businesses are expected to self-report if people get the virus, or people tell on them and then they have to close. But there is no way of tracking actively once someone gets infected, who else they infected. Like there isn't any infrastructure in place to do that. And that is not just here, that is in many cases throughout the United States. So contact tracing and mass testing are key to controlling the spread, and contact tracing and mass testing are not happening on any significant level in the United States. On top of that, so given those like combined barriers of not having access to tests, of contact tracing being sporadic and only available in a few places, and of asymptomatic people or people who may have COVID-19 and display no symptoms, not being able to access tests, all of that together means there are a hell of a lot of people in the United States walking around with COVID-19 who have no idea. It is basically like a black hole. It's like a black hole of information. And so we have like the official count, right? Which again, as I broken down, is off. It does not accurately represent how many people actually have this virus, because it could not possibly, because tests are not available and contact tracing is not being done. On top of that, I lost my train of thought. Oh yeah, wait, nope, it's gone. I'll remember it. Next slide. Oh yeah, so yeah, we have the situation where most people don't know that they have COVID-19. We have the situation where contact tracing is not happening, mass testing is not happening. We have a situation where many, many people have this virus that probably have no idea. And even if they do have symptoms, they can't get tested. So on top of that, in the United States, healthcare is not a human right. And what I mean by that is that in the United States, healthcare is a for-profit industry. It is not set up so that people can get it regardless of, like, you know, their class or their access to resources. It is basically set up that the better, like the more money you have, the better healthcare you get. And if you have no money, you are shit out of luck. You are not a valued member of society. And so this shows up in a couple of ways. First and foremost, in most cases, people's healthcare is tied to their job. Meaning that if you have a job and you work full time, you have to be full time, you have to have 40 hours. If you have a job and you work full time, you might have health insurance. Not even always. I have worked retail and fast food jobs where I worked over 40 hours and I did not get health insurance. But if you lose that job, if you are one of the lucky people who has a full-time job and health insurance, if you lose that job, you lose your health insurance. There are programs, of course, like Medicaid, and there are programs like Medicare, but those are not easy to qualify for. Like if you are a childless adult, or even if you're an adult with children and they decide you make like too much money, even though it's probably not enough to pay your rent, you cannot get those programs. So if you cannot get like that unicorn of a job that offers good benefits and health insurance, If you don't have a job, you are not going to have healthcare in many, many cases in the United States. That is the case for millions of people. And of course, during this pandemic, in the early months of it, they decided we need to flatten the curve. We need to shut down the economy. The whole point of flattening the curve was to, get people to stay home, get people to stay away from each other, and allow time for a public health response to be organized. Of course, in the United States, that public health response never came, but people still did it. People still stayed home. Businesses closed, places of work closed. And as a consequence, millions of people lost their jobs. It's something like over 5 million new unemployment claims in like the past couple of months. And that is from people who lost their employment as a result of this pandemic, looking for resources to still be able to pay their rent. But those millions of people no longer have healthcare because they are not working. And there is no universal healthcare in the United States. These people are without healthcare during a global pandemic of a deadly virus. There's millions of people in that situation in the United States. And the other indication that healthcare in the United States is about profit and not about life, not about saving people, not about healing people, is what happened to the idea of Medicare for all. Medicare for all is the idea that everybody in the United States should have access to healthcare. It should be universally applicable and available for free. It was, of course, introduced by Bernie Sanders the first time he ran for president. He ran for president again in 2020. He was, of course, cheated out of the Democratic primary. That might make you feel kind of way, but that is clearly what happened. He was cheated out of the Democratic primary. But Medicare for all has always been a popular idea. People living in the United States, US citizens, want healthcare. They want free healthcare. It is something that is like needed across communities, across identities, across classes. People want universal healthcare. And despite the fact that this is a universally popular idea, despite the fact that people are pushing for this, demanding this, like taking to the streets, being like, we want this, the people in charge, whether Democrat or Republican, are like, no, thank you. Not only did they push Bernie Sanders out of the running in the primaries, but they completely took Medicare for all as an option off the table. They refused to add it to the Democratic platform. They refused to entertain the idea. Joe Biden and Kamala Harris were like, no, we are not going to do that. And this is again during a global pandemic when millions of people do not have healthcare. What kind of sense does that make? What kind of sense does it make to have a for-profit healthcare industry and not open up access during a pandemic? That tells you right there, they don't care if you live or die. They don't care if you get sick. They're just trying to make money. They're not going to give that to you for free. So that's the situation in the United States. Healthcare is not a human right. And the other thing on top of this that working class and poor people in the United States have to deal with is millions of people have lost their jobs. Millions of people no longer have income coming in, and millions of people are still being charged rent and are still being charged bills and are still being expected to find a way to pay for this despite having no income coming in. So 5 million people and counting are filing for unemployment, and millions of people are currently facing down evictions. Why? Because if you cannot work, you cannot pay your bills. You cannot pay rent. And even though it's like a very obvious fact, probably to people watching this and to myself and to Sheldon and to Roberto, even though it's like fundamentally obvious, for some reason, the people in power cannot, like they just don't, it's like not penetrating. I guess because they like don't pay rent. So there's like no plan. Like there's no plan to deal with the fact that people have not been able to pay their rent for months because they cannot work. And now around the country, like these half-ass eviction moratoriums, they're half-ass because it doesn't matter if you can't get evicted. If you're still being charged rent, when that shit's up, you're gonna get evicted because you're gonna owe thousands of dollars, all piled up. So because these eviction moratoriums were a half measure in the first place, and because they are coming to an end all around the country, we're facing a situation where millions of people are about to be houseless because they're about to be evicted, and there is no plan whatsoever coming from either the federal level, the state level, or the local level to address this on the scale necessary.
Cool. Thank you for that, Oni. it's what's nuts is like we're gonna be laughing in the next couple slides, like laughing a lot, but it's really like messed up because it's not funny. Like people are losing jobs, people are being evicted, you know, as opposed to like here in the US, how was, you know, there could have been a rent freeze. Was there a rent freeze? No. Are people in college debt? Yes. Did that get frozen? No. No, you know, so it's just like thinking about just being able to see how disconnected this government is set up, the systems that are in place set up are for those who are rich, are for those who don't look like you and I, who don't look like Oni, who don't look like me, who don't look like Alberto, who look like other folks who are listening in on this webinar, right? And we got to think about that too, is like the sheer numbers of folks filing for unemployment was over 5.2 million people filing for unemployment. That's after losing their job. Like, again, not being able to make that connection of, okay, you're not working, so you're not gonna be able to pay rent. You get evicted. It's like, that just doesn't make sense. What does make sense is universal healthcare. What does make sense is free healthcare for all of us, for everybody. And that's not even, you know, asking a lot. That's asking again for the basic human need. What Cuba believes in, what we believe in, what our people believe in, you know, what I even believe in, you know, of like that access. You know, it's and Oni mentioned it earlier, you know, of how in New Mexico it's been a little bit different and a little bit more unique is because of like the Pueblo folks, our Pueblo territories, being able to like shut down our borders and say, no, we're gonna like shelter in place here. Yes, there was a shelter in place order from the governor, but also to think about like our tribal governments, right? Being able to think about that and like protect our people, protect ourselves of like shutting down our borders and not letting people come in and out of it, you know, like non-tribal members. And then again, just thinking about like things like that that just make sense to us as beings, as human beings, as people who want to protect ourselves from a virus, from a pandemic. Then you got to think about the access. And then on top of that, we think about folks who were so I'll say it, who were privileged enough, you know, to be working and have access to resources, and then hoard all of those, you know, supplies and things like that. Like even in this picture, you look at it, and this lady's holding up a sign that says, "I want a haircut," and it's like that's where your thought goes to in the middle of a global pandemic. Like that's what you can think of, and this is the basis of which you're out here protesting governors, you know, in your state. A lot of these protests that happen throughout places like Michigan, Washington, North Carolina, Texas, New Hampshire, all of these protests were to protest their governor, to lift the stay-at-home orders, to make sure that shops open up, to make sure that places were open, that even beaches were open, but with limited amounts of time to be out there. That goes to show just how disconnected people are from thinking about protecting yourself, saving lives, and then thinking about just having being out there, like that privilege to be out and about, not really like worrying, not really caring about other people besides yourself, you know. And that literally speaks to like why is that even a thing? And it's because of capitalism. Oni was speaking on it earlier. You know, it's for profit. The systems in place here, quote unquote, U.S. is for profit. They don't care whether we live or die. They care about the money. They care about filling their pockets with that money. They care about having those supplies for themselves. It's individualistic thinking. That's settler colonialism. When we think about that, and we think about where even that ideology came from and how it's gotten here and how it affects us and how it affects those who have, again, the means and the access to even be out there. And again, one, hoard the supplies for themselves. And then two, being able to like perpetuate the system of which that wasn't built for us. That wasn't built for people like you and me. It wasn't built for the folks who are of this land, you know? And it's nuts to think about it because like if you look at the protests, you look at who was out there, you don't see a lot of people like me out there protesting to open up shops, to open up the economy, you know? And you see more people thinking about, okay, well, I need access to healthcare, but I don't have it because I'm about to get evicted because I lost my job because we're in the middle of a pandemic. the stimulus check only goes so far, right? And it's like, yo, like we got to think about each other's protection and protecting ourselves, protecting our people. And that's literally how Cuba is set up. The system's there. And we'll get into this too. We just wanted to be able to showcase like the response here in Turtle Island, quote unquote, US, and the response in Cuba and how that's set up. And again, it goes back to capitalism, settler colonialism, because, you know, it's for profit. It's because the systems here that are set up don't care whether we live or die.
And someone just mentioned in the comments the stimulus, the $1,200 check, the one-time $1,200 check that people got several months ago. They were like, here you go. And then they were like, fuck off. Like, it's just like who, you maybe pay your rent one time or your car note and your bills, and then you're screwed. Like, what are you supposed to do? Like, we called it, in APREP, New Mexico, we call it the landlord stimulus, because basically that money was going to go right to your landlord and you were not going to be able to do anything else. And you could only do that for 1 month. And then the next month you were screwed because you couldn't work. Man, richest country on earth.
So definitely, even like the protests themselves, like the pictures of the protests in other states, there's literally like militiamen, militia people armed to the teeth who are out there protesting to open up the economy.
Right. Whew. Okay, so we talked about the US response and how it's terrible and how it's allowing thousands of people to die. Like, it's a 9/11 every week at this point, over 2,000 deaths from COVID-19 weekly. And it's mostly African, indigenous, Chicano, Latinx, Filipino, colonized people that are dying. And that's a major part of the reason why the US response has been what it was. But now we want to get into Cuba's response. Cuba's much more rational, much more humanistic response to COVID-19. So to start off, one really important thing to understand about Cuba's healthcare system is that it's not focused on putting out fires. It's not focused on people, like, you know, being neglected until they get really sick and then having to go to the emergency room like it is in the United States. It's focused on preventative care. It's focused on holistic community care. Communities in Cuba, towns in Cuba have doctors who live in those communities and serve the people that live around them, treat the people that live around them, oftentimes for their whole lives. They see the entire family. They build relationships on a door-to-door and block-by-block basis. And in doing so, because they have this like lifelong relationship, because they have these like constant check-ins, they're able to like take care of people and identify problems before they become fires, before they become emergencies that threaten people's lives. It is a focus on preventative care, on prevention and immunization and holistic community care, rather than like putting out fires, rather than constant emergencies. It's like, it makes much, much more sense. Like, imagine, you know, the person, like your child's primary care physician living next door to you, and like knowing your family and knowing about your home life and knowing, like, you know, the medical issues that y'all might have, and like knowing like what medicines you have reactions to and what you don't, without having to like look it up in a file. Like, it makes like so much more sense to give people healthcare from birth to death on that basis than it does to allow them to get extremely sick and then force them into a situation where they have to pay thousands of dollars in order to not die. Like, the way that Cuba approaches healthcare is about preventing the fire rather than putting it out when it comes up. So when COVID-19, when the pandemic hit, the response that Cuba organized was like organized on that basis, was organized on prevention rather than on putting out fires. And so because Cuba has like thousands of doctors and medical students, like the highest number of doctors per capita of any nation in the entire world, and this is because of organization, this is because of the revolution, because that's the case, they were able to, at the beginning of the pandemic, send doctors and medical students literally door to door in Cuban communities, door to door, testing people, giving them medicine, giving them correct information about COVID-19. Imagine someone coming to your door with like a test and a mask and like info and medicine. Like, can you imagine that happening in the United States? Like, it's so like out of the question here. Like, in the United States, for the first 2 months of the pandemic, they told us we didn't need masks. They said masks are not required. You didn't even know how to wear it right, you fool. Like, that's what they were telling us. And then as a consequence, thousands of people died. Thousands of people died. Like, there's misinformation coming from the very top, from all levels of the US government, from the president, from the CDC who said not to wear a mask. From the very top, there's misinformation coming. But in Cuba, they are literally sending doctors to people's houses to give them correct information. Can you imagine what a difference that would have made if we had something like that here? Oh my God, it makes me sad because so many people died here that didn't have to die. And again, as I mentioned, primary care physicians, what we know as PCPs, live in the communities they serve, and they make house calls on a frequent basis. They are up in these people's lives, helping them on a day-to-day basis. They are up to date on their medical issues, on their health concerns, and they're able to serve them on a day-to-day basis. It makes so much more sense. It is prevention through primary care rather than constantly putting out fires. The other thing, so Cuba has, a very, very robust biotechnology industry that produces many, many medicines that we cannot access in the United States thanks to the US blockade. And so one of the medicines produced is something called interferon alpha 2B. Interferon alpha 2B has been used in Cuba and all around the world to treat COVID-19. It is a medicine that works by boosting your immune system's response to help your body fight off COVID. It boosts your body's natural immune system response to fight COVID. So it doesn't attack COVID-19 directly. Instead, it helps your body produce more white blood cells and that then go on to fight COVID-19. So when the outbreak first happened in China and China was able to get it really quickly under control, the reason for that was, of course, mass testing and contact tracing, but also medical interventions that included the use of interferon alpha 2B. Interferon alpha 2B was one of the very first medications approved for use on COVID-19 cases in China, and it worked. And then once countries around the world saw that it worked, they began to request it from Cuba, and Cuba sent it all over the globe. So it was being used in Italy. If y'all recall, Italy at one point was the global epicenter of the pandemic. Italy was getting wrecked. And when that happened, what did the European Union do? Did they help Italy? No, of course not, because that's how capitalism works. Instead, all of the European countries surrounding Italy closed down their borders. Italy asked for resources, asked for loans to help fund the fight against COVID-19. The European Union was like, no, we don't think so. So they were basically abandoned, right, by the rest of the countries in Europe. But Cuba was like, all right, we got you. They sent doctors and they sent interferon alpha 2B and they helped Italy get the pandemic under control. A very, very similar thing happened in Spain, which again was abandoned by the European Union. There is no solidarity among capitalist countries at all. So they were abandoned and Cuba stepped up. Also Panama, Chile, Nicaragua, Jamaica, Ireland, many, many, many countries, like dozens of countries have requested and received interferon alpha 2B to fight COVID-19. And also, it's not on the slide, but Cuba has actually produced a vaccine for COVID-19 that is currently in testing. They have tested it with success on a couple of researchers and patients, and they are going to go into wider testing. So that's actually an extremely exciting development, especially because in the United States and in capitalist countries, vaccines are being produced as well, but they are not going to be available for free. They are most likely going to be extremely expensive. And also, the United States medical industry does not have a really great history of producing safe and effective medicines and vaccines. So I would personally vastly prefer the Cuban vaccine, except it is not going to be available in the United States. Can you guess why? It's because of the illegal US blockade. Not only does the blockade prevent Cuba from getting their assorted required resources they need, which we're going to talk about in a minute, but it also prevents people living in the United States from getting access to Cuba's medical innovations, like the vaccines that Sheldon talked about earlier, and also this COVID-19 vaccine. So yeah.
Awesome. Thank you, Oni. Yeah, and even just to go in a little further too, for some reason, it's such a radical thought to have healthcare here in quote unquote US. Such a radical thought to own your own home and not be evicted in the middle of a global pandemic. In Cuba, folks own their homes out there. It's written in, and we'll hear it a little bit too in the next couple of slides. It's written into that constitution the Cuban government to be able to own your own home. You know, out here we have you got paid for years and years and years to own your own home. And if we were able to have that set up in place, none of us would be getting evicted because we own our homes. So yeah, again, it's just such a weird, I guess, again, such a radical thought to want free healthcare, to want access, to have basic human needs. It's nuts. And so again, like, look at Cuba's response. How great and amazing it is. Look at a list of countries, of places Cuba has been in, that Cuba has aided. Not even just right now in the middle of a global pandemic, but for years, since the 1990s, since after the Cuban Revolution, all the countries that they've been in to help. There's places like Belize, Brazil, Venezuela, Haiti, Italy, you know, Chile, China, Qatar, West Asia, you know, Nicaragua, like all of these places. The list just goes on and gets added to every day as well. You know, all the places that Cuba has been able to send the medical brigade, which leads me into the next point as well. You know, it's just like thinking about the medical brigade and where they've been and what they've done, literally saving lives, You can go into it. And there's just a couple images as well about like where Cuba has been. And in this video here, we're able to get to hear about why, literally, like again, why Cuba is set up this way. Why. And I think it's the video is a little long, but we'll share like a couple minutes from it, and it's queued up as well. 8 minutes. Awesome. Oh, it's because you're muted, only. Because it's coming off the back of the
and they, you know, our system has made commitments for those medicines not to get here because they lose profit in our people getting access to them. So, I just want to really quickly, 2 minutes plug in for people who don't know. Like, I think it's very critical to understand as we talk about Cuba as a nation, as socialist nation, we need to understand, because I know some of the questions that I always get is like, well, why would Cuba be this altruistic, and why would they do this, and you know, what is the, you know, what kind of ploy is this? And I think it's very important for people to understand that Cuba, at the beginning of their revolution and what they have built into their constitution, which maintains human rights and is one of the countries that has the most human rights that are adhered to within the world, is that health and education is deemed a right within its constitution for every citizen in their population. They also have within their constitution an idea or a clause of internationalism, where they have deemed themselves the keepers of their brothers and sisters. Yeah. And because they have made the commitment to be a keeper, their brother and their sister's keeper, any and all nations that would need them, when it comes to healthcare or education, they are willing to go out and help. And so that was something that.
Awesome. Thank you, Oni. And again, to be able to hear from, you know, a trained doctor in the program, in the medical program too, it speaks to that internationalism that Cuba is based on, you know, is based out of. And it speaks to creating that solidarity with other countries. Again, keep in mind, amongst US sanctions, amongst embargoes, amongst travel bans, all of these resources not reaching Cuba in an adequate amount of time, or even in an adequate form once they get there, because they get messed with. A port or a ship has to touch a US port from anywhere else in the country before it gets to Cuba. And that's because of US sanctions, because of economic sanctions. And they get there, and all of the stuff, all of the supplies and everything could have been messed with, and it could have been held up for months at a US port, because they know that Cuba needs this. So they're like, okay, we're gonna mess with it, but we're gonna keep it longer than it actually has to be here, because we can do that because of the economic sanctions. And again, just thinking about how Cuba is set up, putting humanitarian first before anything else, You think about how the U.S. doesn't do that. "Quote unquote" U.S. doesn't do that. You can think about the fact of how in Cuba you have a medical program, you have resources set up to train people to save lives, when on the opposite end, you have people in so-called US set up to put more resources into teaching people how to take lives, how to kill. I'm talking about the war machine. I'm talking about the military industrial complex. You think about how many military installations are all over the world. There's over 700 military installations all over the world. Guantanamo Bay being one of those places, being one of those naval bases, and you really think about it again, and it's the fact that a U.S. puts more resources into killing people than they do into saving lives. When on the opposite end, Cuba puts so much more emphasis and so much more resources into just helping save lives that they've been nominated for the Nobel Peace Prize. They've been to over 22 countries. And again, not just because of the global pandemic right now, but because of their readiness and their preparedness that they've had for years, for decades, not just right now for COVID-19, but for all those other years that they've been to Angola, that they've been to other countries to fight Ebola, to fight, to come up with these vaccines to help other countries. They don't only think about themselves and have a program that's set up to go door to door and help take care of each other, but then they think about the world, they think about the globe, and then actually go do that, actually send medical brigades to other places around the world to help to take care of the world, take care of other people. It's just nuts. Yeah.
And really quickly, so the woman in the video that we just showed, her name is Dr. Melissa Barber. She's obviously an African woman who lives in the United States, who went to UNAM, the Cuban Medical School, for free. And now she lives in the Bronx, New York, and she's helping organize that community's response to COVID-19. This is a woman who was trained on how to be a doctor in Cuba, who went back to her community and is now helping fight the pandemic. So Cuba's influence and the resources they shared with my people are helping save lives in the United States. So why is the response to COVID-19 so different in Cuba versus the United States? Like, why is it like night and day? Why are hundreds of thousands of people dying here, like thousands of people every week, literally a 9/11 every week in terms of deaths from COVID-19 in the United States, where in Cuba, they have almost eliminated community transmission of COVID-19. They have, like, when they have new cases, it's like 12 versus like 1,000. Like, it's night and day. So why is it so different? The fundamental difference is that Cuba is a socialist country as a result of a people's movement, as a result of a revolution that was built from the bottom up, that overthrew an exploitative capitalist society and put in its place a life-centered, people-built socialist society. Socialism is a system in which the people collectively own the resources and the wealth of a nation. And instead of having those resources and that wealth hoarded and kept in a few hands like it is in capitalism, instead they're used to make sure that every single person, no matter their age, no matter their status, no matter their gender, no matter their race, is able to access the fundamental things they need to live. They have access to subsidized housing. They have access to free healthcare for life. They have access to free education for life. This is something that the Cuban people built together as a collective through the process of revolution, through the process of building socialism. Socialism is a system that puts life first, not money, not growth, but life, and not just human life. Not just human life, because Sheldon and I both saw, like when you first fly into Cuba, all you see is like green. It's just like green. I'm gonna start crying. It's like so beautiful. Like there's like huge trees and like clean water and like animals and bugs. It's just like, damn. Like we went to this like eco village called Las Terrazas, where they talked about how they literally brought back, species of like plants and animals that had been driven almost to extinction by capitalism. But after the revolution, they were able to restore the land. And then in the first political education seminar we did last month, our comrade Julia from Pueblo Action Alliance talked about how Cuba has this 100-year plan to address climate change, right? How they have a plan to save people's lives. Like Cuba is in the middle of the Caribbean. Cuba is surrounded by nations like Haiti, by nations like Jamaica and Barbuda that are constantly wrecked by hurricanes. But when a hurricane hits, like Cuba might get damaged, but it's not the same. And the reason for that is because Cuba prioritizes not just human life, but the life of the land, the life of the water, the life of the planet. Socialism puts life first, period. It's not on the basis of species. It's about putting life first, regardless of where that life is coming from. And then by contrast, the US is capitalist, right? And capitalism is a system that is about profit over everything, period. Like if it's a question of making money or someone dying, they are gonna go with the money. They're going with the money. And if the person dies and there's a way to make money off of that, they're gonna do that too. They do not care about saving lives. Healthcare in the United States is not about saving life. It's about extracting as much wealth as possible from people, even in situations where they are struggling for their very future. So capitalism is profit first, even if it means death. Socialism is life first, all life, not just human life. And that is the fundamental difference. And the reason why Cuba is socialist is because the Cuban people built that. They built that socialism and they fought for it and they fight for it every day. So we're going to conclude with some information and some resources. First and foremost, we want to talk about the Get Out of Cuba's Way campaign. The Get Out of Cuba's Way campaign is a campaign organized by revolutionary African organizations and organizers all around the country who are demanding that the US government allow Cuban doctors into the United States to assist communities that are dying from this pandemic, to assist African, Indigenous, Chicano, Asian communities that are being left to die by the US government. Cuba is ready and willing to send doctors to help people in the United States. But Cuba is not being allowed to do so because the United States considers Cuba an enemy because Cuba had a revolution and built socialism. So rather than allowing these resources, allowing these doctors into the US to help people who are otherwise helpless, the US is choosing to maintain this political posture that declares Cuba an enemy for being socialist. And as a result, people are dying that do not have to die. People are dying that do not have to die. So the Get Out of Cuba's Way campaign is about getting the US to get it the hell together, to allow these Cuban doctors into the United States to help communities that are being abandoned. So if you want to know more about the Get Out of Cuba Way campaign, please go to the link on the slide, and we'll also put it on the New Mexico Venceremos Brigade Facebook page and my personal Facebook page. But it's a campaign to demand Cuban doctors be let into the United States. And we need folks to spread the word about this campaign. We need folks to share this article. We need folks to build awareness that this campaign even exists, because we need to build the pressure on the US government to get the Cuban doctors within their borders. This is a matter of life and death. There's no help coming from the US government. Thousands of people are dying every single week, and Cuba can help, and Cuba must be allowed to help, period. Also, as we mentioned a couple of times, the illegal US blockade on Cuba, which at this point is like 61 years old, prevents many really necessary medical supplies from even reaching Cuba in the first place. Like Cuba has all these medical innovations, like despite the United States, despite like an extreme amount of interference and sabotage from the US government. This is what Cuba has accomplished. So they cannot get ventilators in a lot of cases. They cannot get the N95 masks that medical workers need. They cannot get a lot of extremely necessary medical equipment, again, due to the illegal US blockade. And on top of that, happening again during a global pandemic of a serious respiratory illness, they also have daily shortages of basic things like food and fuel, because the United States will literally intercept ships of goods, of things like oil and goods that Cuba already paid for, They will intercept those ships and they will prevent them from reaching Cuba. So US is standing directly in the way of Cuba organizing an even better global response to this pandemic. And the US blockade has cost the Cuban economy trillions of dollars, and it has cost thousands of Cuban lives. It is illegal, it is genocidal, it is a crime against humanity, and it needs to go. We need to end the US blockade.
Definitely, yeah. Just to go a little further too, like, yeah, sanctions, sanctions again are just They're supposed to be alternatives to war, but there are other ways in which, like, the U.S. targets quote unquote lower class people, the working class, colonized people, and literally stop from resources reaching Cuba. Literally, food and goods, fuel, and oil. Even when we were there, they spoke about this a little bit at the biotech facility. And one of the researchers there was shared the story with us of how sometimes in the summer, in the dead of summer, that they will be working in these facilities without AC, without any power, without AC. And they're out there because they understand that this work is going to benefit the people, their people, and other people around the world. You know, if that were to happen here, what do you think will happen here? Probably people will go say, "Oh, I want to go get a haircut" or something like that. You know, people will go protest it, and it's just like, nah, like, you got to think about it. The sanctions that are set up, the U.S. embargo, all of these again set up to literally just target the people again, the people of quote unquote undeveloped countries. You know, I say quote unquote because it's like, nah, like, these aren't undeveloped countries. These are just countries who are living in a way that they are free, living in a way that they are being who they were meant to be, living in a way that they're being themselves. And those are one of the things that they want is free healthcare, is access to free healthcare, is access to resources, to just live, to be, and to get by and meet those basic human needs. And it's not just in Cuba. This happens all over the world. The same thing happens with the oil, with ships trying to get to like Venezuela or trying to get to other places around the world. And you know, the U.S. steps in and seizes those goods. Not even just seizes them, but then they're able to put fines on them. If other countries go into business with Cuba, they're able to give them fines like $1,000, $1 million fines, just because they're going into business with Cuba, or because they want to help and create that and be able to have that relationship, or even build that collaboration. So the US knows that. So they're going to put a fine on that and like really just like bully other countries into not working with Cuba. Again, like I shared that earlier, if a ship leaves another country, it has to touch a U.S. port before it gets to Cuba. You know, that's part of the sanctions. That's part of like those. Again, like Oni said it best. What she said. It's like it's genocide. You know, it's basically committing genocide. Sanctions is committing genocide in other places of the world. Sanctions also help the U.S. overthrow other governments, create military coups in other governments, in other countries. Sorry, in other countries. And if you and to learn more too as well, you can go to sanctionskill.org, and there's literally a breakdown of sanctions in other countries, a list of how many other countries are sanctioned by the U.S. And there's really good there's infographics there as well. Even the reason why I'm able to even speak about some of these like facts of like the ships being seized or the fines that are placed on other countries or other businesses going into business with Cuba is from also from that website sanctionskill.org. So I highly encourage checking out that website as well. We can put it again on the New Mexico Venceremos Committee Brigade Committee page, as well as the Pro Action Alliance website. There's a link there as well underneath the New Mexico VB page as well.
So that was the end of our presentation. We have a couple of comments that came through that I'm just going to read. So Arnold Trujillo on Facebook says, now is the time for Native America to ask Cuba for help as sovereign nations. I sent a letter to some presidents suggesting this, no response. And do you want to speak on that, Sheldon?
Yeah, my question would be to the presidents. Thinking, was that presidents like the quote unquote US, or like, you know, because of course the president isn't gonna support that. They don't even like our nations here. You know? But I really do believe that. I believe in the sovereignty, especially when we were sharing earlier too about how we would like shut down our borders and keep non-tribal members going in and out because of the spread. or the spread of the virus as well. That's something as well. Like if we look back at the relationships between Cuba, look at like the Mohawk delegation that went over there to learn about the diabetes vaccines, and then even like go into collaboration with that. You know, that's something we could be doing here too with other nations as well, especially in the medical field, especially in those advances. There's so many ways that like there could be nation to nation building, people to people building. You know, being there, it was really cool to see that and just like think of the possibilities, because it is in fact very possible. You know, it could happen. It can be done. And it's up to us, like people like Oni, people like Roberto, like Julia, like Arnold, to think of these things and then like, you know, be able to think of how we can have that happen, make that happen.
And then we have a couple of comments from our comrade from Cuba, from ICAP. Lesman Bonachia Island, she says, greetings from Havana, Cuba. Thank you so much for your support and solidarity, friends. Really proud of what you are doing. Hashtag unblock Cuba, hashtag the blockade kills. And she said, hi to you, Sheldon. Greetings from Havana.
Awesome. Yeah, greetings. So, take care.
Yeah, I don't see any other questions or comments. But we want to thank y'all for tuning in. Do you have any closing comments, Sheldon?
Yeah, just thanks again. Thank you. Gratitude to everybody tuning in, for taking the time and listening to us. And yeah, follow the New Mexico Venceremos Brigade Committee on Facebook and follow our organizations as well. That's All African People's Revolutionary Party, Southwest Organizing Project, and Pueblo Action Alliance.
Right. Oh yeah, and Arnold clarified that he sent a letter to the D-Name president, so not the youth president. So yeah, thank you for joining us. Thank you for tuning in. As a reminder, we do these seminars at the last Wednesday of every single month at the same time, 6 Mountain Time. We're going to cover a different topic about Cuba and the Cuban Revolution in depth every single month. It's always going to be free. You can always watch it online. We hope you join us every month because, like I said at the beginning, it's like nothing but lies about Cuba. Like we hear nothing but lies about Cuba, about the Cuban Revolution, about Fidel Castro, about Che Guevara. So it's really, really important, especially like having been there and seen that it's lies. It's really, really important for us to like share this with the world and like tell the truth. Tell the truth. Like Cuba is a force for good. I can't even imagine what this pandemic would be like if Cuba was not around and like helping the world. Like my God, like so many people would be suffering without Cuba right now. So we owe it to Cuba to show up in this way and to tell the truth. And we hope that you will tune in and like learn with us. And as you like get this information, that you will share it with your community as well. Share it with your family, share it with your friends, and tell the truth about Cuba. There is so much we can learn from Cuba. There is so much that Cuba can share with us that will make our lives better here, and it's not being allowed to do so. So please tune in last Wednesday of every month at 6 p.m. And in the comments, we have someone posted a link to cubanobel.org, which is the campaign to give the Nobel Prize to the Cuban doctors that are saving lives during this pandemic all around the planet. So check that out, cubanobel.org. And let's see. Oh yeah, and then also Comrade Trujillo is saying if anyone is interested in medical school, don't forget about the Cuban medical school program. So yeah. Thanks y'all, thanks for your participation. Have a good night.